I, Harish Bharadwaj, Vice President, Indian Optometry Federation. Indian Optometry Federation is apex as the sole national representative body of the optometry profession in India. IOF was established with the vision of creating a unified, strong, and forward-looking professional identity for optometrists in our country. As a federation, an association of associations, it brings together ophthalmic sciences such as optometry and ophthalmic officers, academic institutions, and professionals from across the length and breadth of India, ensuring that the diverse voice within the profession are represented under one common platform. What makes IOF unique is the national jurisdiction and official recognition as the only professional body representing optometry at the country level. It serves as the collective voice of optometrists in India, engaging with policymakers, regulatory authorities, healthcare institutions, and international organizations to advance the profession and safeguard public eye health. With this brief introduction, we move forward to today's session. Our moderator for today's sessions are Mrs. Anuprakshi Malik, Head of the Department, IIMP University, Meerut; Ms. Nishtha Verma, Assistant Manager and Trainer at Biotech Vision Care. So this is the, now we'll bridge towards our moderators.
Hi everyone, so I'm Nishtha Verma. I work as an assistant manager and trainer in Biotech Vision Care and even a part of Optometry Association Himachal as a general secretary. So it's a great privilege to moderate the first webinar series 1 by Indian Optometry Federation in collaboration with Optometry Association Himachal. Before moving forward to the session, I want to give a brief about Optometry Association Himachal, which is the only registered body in the field of optometry to ensure every individual in our hills have access to high quality eye health service. And our mission is to foster continuous professional development, advocate professional in optometry, and bridge the gap in the community across Himachal Pradesh. So moving forward, I am honored to introduce our today's guest speaker, Dr. Gaurav Kumar Bhardwaj. So if I talk, he is a associate professor and head of the Department of Optometry and Vision Science, Amity University, Haryana. He is currently serving as a president in Optometrist Society, Haryana. He is the general secretary of Indian Optometry Federation, and he is also having a lifetime fellowship of International Association of Contact Lens Education and fellow of Association of School and Colleges of Optometry, India, Low Vision. His main research interest relates with antimicrobial contact lenses, dispensing optics, low vision in practice management. He has taken many keynote lectures in various optometry conferences, national and international level. He is the author of 3 book titles: Low Vision Evaluation, a practice guide for optometrists, textbook of occupational optometry, and significant binocular vision. So today he's going to shed light on topics, career avenues in optometry. Without further, let's warmly welcome Dr. Gaurav Kumar Bhardwaj, and I hand over the session to Dr. Gaurav Kumar, sir.
Thank you, Nishtha, for a very nice introduction. Let me share my presentation now. So is my presentation visible too?
Yes.
So today we'll just discuss about what optometry is at the first start, and then we will discuss about various career options. Because at present, when the optometry students are going to pass, this is a maximum doubt everyone has in mind that what to do next. Because there are students which are there doing their internships and final years, and the doubt comes where to go, because there are many ample of opportunities are available. So first thing is we have to understand what optometry is. This is as per the curriculum which is released by for optometry by Ministry of Health. This is optometry means the healthcare profession that is autonomous and concerned especially with the examining of the eyes for defects and faults of refraction, with prescribing correctional lenses, eye exercises, or visual rehabilitation care for visually impaired, and with the diagnosis of the diseases of eye and treating such diseases or referring them for the treatment. That is just the description of the profession. But World Council of Optometry defines optometry as a healthcare profession that is autonomous, educated, and regulated, licensed or registered, and optometrists are primary healthcare practitioners of eye and vision system who provides comprehensive eye and vision care, which includes refraction and dispensing, detection, diagnosis, and management of the eye diseases in the eye, and rehabilitation of the conditions of visual system. This is the international definition given by World Council of Optometry. And now we come to the duties and responsibilities of an optometrist. Once you are becoming an optometrist, these are your duties. This is according to the ISCO code 2267, which is being adopted by NCHP also for an optometry as a profession. Wherever you see the name of the optometrist, you will find this code is mentioned in the act. So this defines that these are the duties, like optometrist has to examine eyes of the patient, conduct diagnostic tests to assess ocular health, and determine the nature and extent of the vision problem, and testing of the visual function using specialized instruments and equipment for measuring the visual acuity and refractive error, functions of visual pathways, visual fields, eye movements, freedom of the vision, and intraocular pressure. Then detecting and diagnosing and managing eye diseases, including prescribing of medications and treatment of the eye diseases. So this is, I am not talking about a particular country. This is as per ISCO code. So consulting with the referring patients to an ophthalmologist or other healthcare professions if added medical treatment is required. Then detecting and diagnosing of the eye movement disorders and defects of binocular vision function, and planning and managing treatment programs, including counseling of the patients in eye exercises or coordinate movements or focusing of the eyes, prescribing the correcting eyeglasses, contact lenses, and other vision aids, and checking optical devices for performance, safety, comfort, and lifestyle, advising visual health matters such as contact lens care, vision care for elderly, optics, visual ergonomics, and occupational and industrial safety. These are the duties and responsibility of an optometrist. Wherever you are working, whichever area you are working, geographical area can be any, and the professional area also can be any, but these are going to be your responsibilities if you are an optometrist. Then we think about career options after Bachelor of Optometry, what we will be doing. So once you have done with the Bachelor of Optometry, you can now we will be exploring about clinical, corporate, academic, and research areas. Like who choose optometry as a career? First thing is, now there is a very big growing demand of the profession, because at present we have only 30 almost 30,000 ophthalmologists in the India, if we talk about India only, and we have only 20 to 25,000 optometrists, which is the data is available. Optometrist numbers may be more. There are many unqualified people who are claiming to be an optometrist, but the data is not available. So ideally we say around 30 to 40,000 optometrists are there, which we say as an optometrist, which are available for services in India. And the huge demand is like we need almost 2 lakh optometrists for the population of 1.4 billion. So there is a huge gap in the service provider, and that's why when there is a gap of the service providers, the other people start encroaching in the profession. So that is also there. So career opportunities are there in global levels also. Technological advances are also happening. So optometry, you can, once after you're completing with the Bachelor of Optometry, you can go either in a higher education, or you can do your go in a research and teaching career. And Master of Optometry is also one of the option. Like once you decide that you want to upgrade your skills, you can definitely go for a Master of Optometry and find out better clinical and other roles. So job roles may be varying if you are upgraded your qualification. It is like if you are a Bachelor of Optometry, you are a general optometrist. Once you are doing a master's, you become specialist. Then you can also go after masters, you can go for PhD also. PhD is available now in almost 7 to 8 universities in India, and abroad also you can go. So in PhD, if you are thinking of going for a PhD just to go in an academic career, that is also okay. But after PhD also you can go in research and development and join the research and development wing of the various multinational organizations or various organizations where they are working on the product development and research and development. Then these are the various practice avenues where you can practice. Once most important and is corporate sector. In corporate, then we will discuss one by one what is the job role in the corporate sector for an optometrist. You can work in a private practice also. You can start your own practice, work in an optical chain under an optical store, and you can work in a public health settings where you can go lots of eye camps. You can work on public health planning and policy making areas also with the NGOs. Like lots of NGOs are working in this sector. You can work in the industries like frame manufacturing industry, ophthalmic lens manufacturing industry, contact lens manufacturing industries. There are a lot of opportunities are there in that. Eye care hospitals and education sector like colleges of optometry, you can work as a faculty. And scientific research and integrated professional areas are also there. Like you can go in research, develop a new product, develop a new technology, and get it patent and give it to the companies, and you keep doing that. So in corporate optometry, what we have to do, there are lots of retail chains which gives you a role of a trainer or professional services where you actually deals with the patients, guide them regarding the dispensing of the glasses, about contact lenses, about sunglasses, and there you can work as a clinical optometrist also. You can work as a trainer also. They're like in retail chains. The optometrist has a various roles. Like at a junior lower level, you will be only involved in one clinic. Then once you are getting a senior position, you will be promoted to a trainer position. And when you are going in more senior position, then you will be giving it a role of a managerial roles also. So same thing can happen. So in the corporate sector, private practice, you can have an independent clinic or you can have entrepreneurial opportunity. You can start up, make any of the specialty. You can work in that. Then clinical optometry is like primary care practice where you examine patients, see that, and treat them accordingly depending upon the condition. Diagnosis and management of the visual disorders, you can go in the like have a diagnostic center also. You can add more machines where you can have a diagnostic services in your private practice also. You can do that. You can work in a hospital also. So in a hospital based, what you can do, like optometrist main job role is going to be the same which we have told you, that you have to examine patient for their eye problems. But in the hospital, because the medicine part is going to be taken care by ophthalmologist, so here you have to be more precise about rehabilitation part and the therapies. Like you can give vision therapies to the patient, contact lenses, dispensing spectacle dispensing, rehabilitation, low vision, myopia clinics. So there are many more to do, and multidisciplinary healthcare teams, you can be part of that team. Then in specialty clinics, you can also specialize in areas like pediatric optometry where you will be dealing with the kids, and you will be specializing in examining special treatment types of instruments and special kits also. Like there are many kits, like very young kids are there, like 2 months, 3 months. So you will be learning the techniques how to get their eyes examined. That is a specialty which you can develop yourself. You can work in contact lens and low vision clinics also. So that is also specialty area where you can excel. Then in dispensing optometry, you can have the frame and lens dispensing. You can go in the optical shop management also. Then in contact lens specialty, if you are going, then you can work like in normal contact lenses, like soft contact lenses or RGP contact lenses. You can also specialize and practice specialty contact lenses like scleral, mini scleral, and orthokeratology. And so those are the special lenses which specialty you can also upgrade your skills and then start practicing that. That is also a very good option. Low vision rehabilitation, the one part is that you have to examine the patients properly, counsel them, give them certain devices if they are requiring, so manage their visual correction, and you can also add rehabilitation services. Once you feel that vision is limited to those patients, you can also provide rehabilitation services to them. Then pediatric optometry, this we have already discussed. So you can do a basic eye care, and you can also do visual development management also for the kids. Sports vision optometry, this is also an area which is not much practiced in India at present, but internationally it is practiced very nicely. So wherever you have the athletes, so their performance enhancement, as an optometrist, we have to give them certain therapies to improve their hand-eye coordination, their performance, and it is being recorded. There are science behind this. So it is being recorded that professionals or the sports people who are taking uh, these type of therapies, their performance is actually increased. And you can also think of going in this particular area as your specialty, and you can start practicing. At present, India is also investing a lot in sports, like IPL is there, so lots of players are going for cricket, lots of players are going for football, other sports also, for Olympics, for other so as a professional, you can also help those athletes in improving their performance when they are performing in international events. Industrial optometry is there, like occupational eye health. So this is the area where you can specialize in doing the workplace assessment, how the eye health can be improved, improving the ergonomics of the workplace. So that is also an area of specialization. This is also very limited practice at present. Only very few optometrists are there in India which are practicing this. So this is also a very good avenue for the newer optometrists or a young optometrists, we can say. You can specialize in that area, go in or corporates where you can see the workplace and improve the work provide areas in that particular for the workers. And if the workers are seeing better, definitely the production of the company is going to increase, so they will hire you as an occupational optometrist, or that is also a specialty for occupational. So it can be any industry. So you have to assess the potential reason for their damage of the eyes, and how they will protect them with that particular area. Then you can work in a public health like community eye care. You can start your own eye camps and other activities, and you can also work with NGOs and government programs. You can take part, and you can be part of that. You can work for NGOs, like there are various NGOs which are already working, Sight Savers, there are Orbis, there is many other NGOs which are also working in different areas of the country. So you can involve with those NGOs. Even government has NPCB, which is the program which is run by Government of India. You can be part of that and help in government in reducing the eye problems in the country. Teaching and academic, this is also an area where you can also think of going. So once you want to be a teaching role, then you have to be more skilled. So then you have to complete your master's, PhD, and other higher education to become the faculty in a college. At present, the rules, as per the rules, you should be minimum masters of optometry to become a faculty in any college. But in future, it may be requiring your PhDs also. So it is better if you are thinking of going in academics, becoming a lecturer or professor role. So you have to be upgrading your skills, your research skills, and your teaching skills. So you should be good in first. You should be having good skills yourself. Then only you can teach to your younger generations. Then research and development. Research and development is an area where you can also excel. Suppose you want to develop some new areas. Now latest technologies are coming up. So you can also take part in that. Now there are various diseases which is there. And for them, we say there is no treatment available. Like RP is one of them. There are other diseases and which has to be managed properly. So in case of vision research, we can have our research area is open. Clinical trials also you can work on that. So if you are developing some new products, some new technologies, some new interventions which can be helpful for the patient and for the profession, then research and development is the area for you. So you can be a part of that team which is developing some new technologies. Like dry eye is an area where lots of research are happening, and everyone is now, because people are working more on computers and other things, that is also part of occupational optometry. And also you can do certain research areas of how to improve the quality of life of the patient regarding that. So that is there in various areas, like in glaucoma research also you can do, you can do in contact lens research, you can do in vision therapy research. So there are lots of softwares are coming up, lots of hardwares are coming up. Now AI based tools are coming up also latest. And now at present you can see, now if you search, there are contact lenses which are available, so which has a sensor in that, the camera in the contact lens itself. So their technology is anything. Now you might have been seen Meta lenses are there, Meta eyewear, which is through different companies. So that is there, that you have in the spectacle, the camera is there, AI is also embedded. So that is the technology which you should be also knowing. And if you can contribute in that, you can also be a part of the team which is making that. Then another area which is now also developing, which is medical writing and editing. So this area, till now, various optometrists were also not knowing about that. This is also one of the area, because there are many doctors or many medical professionals which have lots of patient load, lots of data is there in India, but they are looking for the people who can write journals for them, who can write articles for them using their data, and they can publish in the research paper. And that is the requirement is very big. So you can also specialize in research, scientific writing and publications. You can be a editor of the journal, editor of the publishing house. You can also be that. So that is also one of the area where you can think of going as your career. Then you, in the optical industry, you have lens manufacturing industry. You can have instrument companies like Zeiss and Humphrey. There are many other companies which makes ophthalmic instruments. So in those companies, your role will be as a trainer about teaching the people or optometrists and ophthalmologists about the latest equipment which is launched by their in industries. Like there are many companies which are coming up with the every time new design of the lenses. Spectacle lenses also there are, in contact lenses also, like various type of lenses are available every time, because every big companies, they have their own research and development unit, and their job is to every time develop newer products. And at present India, you have a professional services role is to train all optometrists, ophthalmologists and opticians about the latest product which a company is introducing in the market. So you can be either part of the research and development team, or you can be part of the training team, which is professional services. So, and you can also become clinical application specialist. That is, a certain courses are required to become that, and you can also do clinical trials. And there are various companies which are looking, like in pharmacy also, which are looking for the people who can do perform clinical trials as per the guidelines. So you have to be upgrading your skills in that, doing performing clinical trials, because now in India also you have see lots of research and development is happening. Government of India is promoting research and development, Department of Science and Technology, Department of Biotechnology. They are promoting research like anything. So the funding opportunities are there. There are various fellowships are also available through the Government of India, where you can apply for the fellowship. Like junior research fellow is there from UGC. You get a funding for your PhD work, and after PhD also you get a funding for your research work. If you want to have a idea in research, you can also go in that area and get a funding for your research work, get something new, and you can get a patent of that. And finally that patent you can send it to the sell it to the companies which are selling those type of products. Sales and marketing role, mostly the product education. This is the role which most of the optometrists which you might be seeing the working in the companies, they are having this role. They just teach about the product of the company to general optometrists and opticians and ophthalmologists. Professional sales team is also part of that. Eye care startups also, you can think of having your own startup. You can work on the problem which is not being solved yet. So if you think during your internship you have come across any problem which is you feel which is not solved till now and there is no solution available for that, you can work on that, bring up some solution for that problem, and you can have your startup done. So, and at present, Government of India and even most of the universities are also having incubation cells in the university campuses. So you can approach those innovation, this incubation cell, present your ideas, and you get a funding also from that. And you have the specialists sitting in those incubation cells where you can get a hand holding as well. Innovation and technology, this is again, if you are interested in research and development, so you can develop newer products which can be used for by optometrists at a large, or by opticians or ophthalmologists. Like OCT is also one of the machine which was invented by an optometrist, so and which is now largely used by everyone. So there are certain instruments, so you have to find out the gap. For becoming an entrepreneur, you have to find the what problem of the society you can solve. So you have to work on the problem, and when the problem is there, then you have to find out the solution. You have to provide the solution. That is the business, how the business has to be. So if you are providing a solution for a problem, then definitely your startup is going to excel like anything. Or if you are interested in working in a hospital only, you can also go in the area of administration, like health administration. After Bachelor of Optometry, you can get any degree in management, like MBA in hospital and healthcare management, or a Master of Hospital Administration. After that, you will be becoming manager in the hospital, and you will be having managerial roles. Or so that is also important. Now most of the hospitals are also increasing their number of branches. Like you might see, there are hospitals which were having only one or two hospital. Now every hospital is increasing their branches in almost every city. So those hospitals are requiring managers, and optometrist has a very better chance for becoming a manager in a hospital, and uh, see the daily day-to-day care administration part. So that is also a upcoming opportunity for an optometrist. Your role is not only to examine patients in the clinic, you can also handle day-to-day administrative tasks also. Regulatory and quality roles also, like compliance and quality checks. This is also there in medical device regulations also. If you are selected, you can apply for the such roles. International opportunities are definitely there. You can think, if you whichever country you want to work and practice, you have to clear a licensing exam there and start practicing. Government sector also, if some of you are interested in going in government sector, there are various hospitals, jobs keeps coming depending upon the role. So you have to keep looking that. In PSUs also, like NTPC, ONGC, there are in hospitals, railways and public hospitals, and the job keeps coming for that. Then future trends in optometry. Nowadays, you might have think about AI and imaging. So majority of time when you think about AI and imaging, even in ophthalmology and optometry, we are having lots of instrumentation, which is now being coming up and this instrumentation AI is also incorporated. Like you might see lots of fundus cameras are available now, which has included AI also for making the easiest diagnosis. And even the pictures of eyes we can just click the picture of eye and the diagnosis will come. So that is also there. So you can also upgrade your skills in AI, developing AI based imaging tools, various softwares, various instruments, and then you can also become a specialist in that area. Teleoptometry is also one of the area which is going to be booming, because demand of is very huge for an optometry services across India, and optometrists are not available in most of the part. That is also a limitation. So you can even train yourself to provide teleoptometry services, so you can cater almost even the villages also for the people. So that is also a very good option. Or with the teleoptometry tools or machines, you can have a second opinion also with your colleagues and seniors. So that is also a good opportunity, because earlier the practice was like whatever we have seen, we have to based on our own decision, but sometimes you are stuck in the clinical decision making. So teleoptometry gives you an idea that you can send the data to your senior and take his opinion regarding the case. So that is also the area which you can update. You can have a startup in this area. You can have this in tie up with the various hospital, do a corporate setups, or you can go in villages, see the patient's examination, and you can collaborate with the hospital. So there you can directly a patient can be treated there with your team. Conclusion, we can say you have a multiple career pathways are there in the newer avenues. When we say future trends, nowadays even the myopia is also increasing very fast, so you can also improve specialize in myopia control strategies. There are certain strategies which are there. There are myopia control spectacles, myopia control contact lenses are there, which is orthokeratology. You have now even atropine of small doses of atropine, but there are further many things which can be done to prevent myopia. And this is the area where you can specialize and go in that particular area also. That is also part of the specialization. So think so there are multiple career pathways which an optometrist can go. So don't think that optometrist job is only to sell glasses. So optometrist has very big task and big responsibilities to do. As a eye care professional, you have to continuously learn and grow, because if you are not learning, then growth will not be there. So you will be doing only one task. So if you want to grow in life, you have to upgrade yourself and keep reading and upgrading your skills also. So this is all. If you have any queries, I will be happy to answer all. Nishtha, we can take questions if there is any.
Yes, sir. Just a minute. I will be connecting, and we are just starting the Q&A session, sir.
Okay.
Yes.
Good afternoon to all. So this is Anuprakshi Malik, Head of Optometry Department at IIMT University. So thank you so much, Gaurav sir, for this highly informative and insights session. We will now forward to the question answer session, where I will be putting the forward few questions on the behalf of audience. So our first question is, sir, to beginning with, could you please elaborate on the scope of optometry today, both in the clinical practice and emerging fields?
Just now I have told everything. That is the same question, which we have already answered.
Okay. And sir, our another question is, as technologies increase, especially with the growing of the artificial intelligence, do you think like artificial intelligence can replace optometrists in the future?
No, not at all. Because artificial intelligence is a technology which is going to be helping optometrist in decision making, or a clinician, we can say even the ophthalmologist. So, but it cannot replace optometrist, because the clinical decision and clinical test which you have to perform, that has to be performed by you only. No artificial intelligence can perform refraction. No artificial intelligence can teach how to insert a lens, how to remove the lens, and all the instructions. So that is a skill. Definitely in future, as technology is upgrading, the skill role of optometrist may be changing. So you have to be ready to upgrade your skills every time when the newer technology is coming. You have to learn technology as fast as possible, and so then you can be at par with the industry norms. Otherwise, if you are not upgrading yourself, you will be outdated. So it is the responsibility of every optometrist that you have to update yourself and learn through the seminars, conferences which are happening, and whatever is the new thing coming in the industry, you should be aware of that. So that is the role of an optometrist.
Okay, sir. So our another question is, like for a student and the fresher graduate after completing their degree, what would you suggest that they should focus on, or should they go for the immediate job or pursue some higher education?
See, it depends upon what is your aim in life. If you want to have your own practice, there is no harm in going for your own practice after bachelor's. But if you want to learn more, have more specialization, higher qualification, definitely you should go for masters. And After masters also, immediately, if without experience you are starting a practice, then you may stuck sometimes. So you have to have certain experience with some seniors. So where you should be having confidence in handling cases and complicated cases, then only start your practice. That will be more better. Otherwise, if you want to start a practice immediately, you can do, but you should be also upgrading yourself regularly about the newer technologies, newer things, and your managerial skills also you have to improve. Because running a practice on business is not only about the clinical part. You have to be having a managerial skill also to run your own practice. You should be knowing the laws of the land, which is governing your practice in that particular area. So running a practice is also a big task. And if you want to do a job, that is no problem at all. You can work, but you have to make sure that after 5 years where you want to be and take a decision accordingly. If you feel, okay, I want to be in my own practice after 5 years, and you have to also make sure like you are a bachelor, only bachelor having a practice, and after 2 years some master's student comes, some of your junior comes after masters, so whom patient will show, that also you have to think. At present also, like if you are having a MBBS and MS, whom you are going to show. So the same thing is going to happen in optometry. If you are a postgraduate optometrist and a bachelor optometrist, whom patient will like to show. So that is also, so higher education is is also everyone should be thinking of upgrading to your qualifications also, but there is not a compulsion in that case. It depends upon the person to person, because you have to take a call, because everyone cannot do everything. So everything, whatever is your cup of cup of choice, you have to decide. We cannot say one line of professional growth is for everyone, which cannot be, because every optometrist is different, every person is different. So your job is also going to be slightly varying. Your progress of the career may be different than the other. Like someone who is joining corporate immediately after bachelor's also, they are also doing very good, and simultaneously you keep on upgrading your skills. So that is possible.
Okay, and sir, another question is like, what about those diploma holder optometrists who want to explain it in the terms of degree? What are the provision for them?
At as present, if we see, there are many universities which are offering lateral entry programs. So they should be immediately going for joining a bachelor program which is full time. And NCHP Act simply says okay, the person who has done 4-year bachelor's of optometrist minimum, he is only going to be registered as an optometrist. Others are going to be getting a registration as an ophthalmic assistant. So you should be minimum 4-year bachelor of optometry, then only you will be registered as an optometrist.
Okay.
So if you are a diploma, the job is not a problem for you all. You will get a job, but problem will be your designation, and your skill also is going to be limited only.
Okay, and another question is, sir, like what have been the key outcome and the contribution of different optometric association and group?
Group. See, optometry associations, why optometric associations are being made? That is for welfare of optometrist, by optometrist. So if we want our association to do anything for us, we should also be making a habit of contributing something to the association. At least if we don't have a time to contribute time, we can at least become a member of those associations. Because at present, whatever associations we have, none of the association have a data of more than 3,000 to 4,000 optometrist members. So when we talk about what associations are doing for us, no one is going to do anything for you unless you do for yourself. So if you are not a member of an association is not liable to do anything for you. So this is the request for all optometrists who are there. They should be part of any state association in whichever state you are working, and that association should be a member of IOF at the end. So IOF is the body which is representing nationally to the government. So associations are doing their job, their office bearers are doing their job. Only thing is you have to be active. If you want to know what associations are doing, you have to take active participation, and they will be happy to take a help, because every association is this is India is a very big country, and we have every state a single association cannot work. So we need state associations. Now state councils are already there in place, so you have to be in work in collaboration with those councils.
Okay. And sir, another question is like, which career path in the optometry do you think has the highest earning potential?
It is your own practice. There, in your own practice, you have no limits. If you have a business, you can have n number of branches. There is sky is the only limit when you have your own practice. And there are optometrists which are coming in crores, you can say, not in lakhs. But it depends. It takes a vision, it takes your efforts, it takes a skill also. Like you should have a managerial skill also along with your clinical skill. Then only you can have, like, money. If you are running behind the money, you will be nowhere. So you have to work, run behind the excellence. If you have the excellence in your practices, money will follow. So money is not a limit in optometry. A simple specialty, if you are only working in a simple specialty, you can have a limitless money, because there are scarcity of optometrists providing good services. Majority of optometrists are only busy in doing refraction in India. That is the major problem. And refraction, after diploma also person can do refraction. Then what is the difference between an optometrist and a diploma holder? No. So none of the hospital or a company is going to hire an optometrist just for doing refraction. Because when a hospital is thinking of hiring an optometrist, they are expecting that he should be able to do all the specialty areas which is taught. So if we want to upgrade ourselves, we have to upgrade our skills also.
Okay, sir. And next question is like, what additional certificate or course can boost in the optometrist career?
See, there are n number of certifications which are there. Like if you want to go in a management role, you can go MBA. That will be adding to become a managerial role in an organization, in a corporate organization, whether it's a hospital, whether it's a retail chain, whether it's a optical manufacturing company or any other company. Or if you want to have a specialization, you want to have a practice like a specialist, you have to earn your skills, and basic qualification also has to be upgraded. Like only bachelor's may not be enough. You should be going for masters, and certain fellowships are there which are specially for that particular specialty. So you can go for those fellowships also. Like there are fellowships in vision therapy, there are fellowships in low vision, fellowships in contact lenses. So those fellowships will add very big skill enhancement in your knowledge. But just don't go behind the name of the fellowship or name of the certification only. You see that what clinical skill or what skill you are going to learn through that certification. Because just getting a certification means nothing. You should be having a skill also. Suppose an optometrist, a patient comes with a RGP contact lens requirement, and you say, I don't know how to give a RGP lens. So this should not be there. When you are an optometrist, you are supposed to know everything.
Sir, and one question from student side: what skill shouldn't the optometry student focus on to get the better job opportunity in future?
See, at present, the optometry students should think of two major things. One is their own personality, soft skills, communication skills. Every student should have a good communication skills. More good you are there in communication skills. Clinical skills, definitely you have to be knowing. But if you don't have a good communication skills, you will not have get a chance to show your clinical skills. So you should be presentable, because you have to see patients every time and the patient don't know you. So you have to be in a position that when you introduce yourself, patient should be easily ready to take provide his eyes, that he's okay to get his eyes checked with you. And the communication skills also is going to be very important. So if as as if you have a qualification and you don't have a communication skills, you will be sitting idle in your clinic. Even if you have money, you have started your clinic, patient will not be happy with you. And even in the corporate hospitals, when you go and for the interview for the job, then they also look for the personal grooming and your communication skills. And we have seen most of the students, even if they were having very good clinical knowledge, but if their presentation and communication skills were poor, they were not selected compared to the average student whose communication is very good. Even corporates are looking for the people who are good in communication skills. Their presentation skills should be good. So when you cannot present your knowledge to the group of people, most of the corporates will not like to take you as an optometrist also. So this is the most important skill which any optometrist should acquire within 4 years of duration. Apart from the clinical skill, clinical is must. Your communication is very good, but when it comes to the clinical, they give you a patient, you're not able to examine him properly, then definitely they will not take. So both are more important. First is your presentation, your communication, and then your clinical skill also should be there. Then no one can stop you in excelling in your field.
Okay. And sir, what are the PhD options in India versus abroad?
See, PhD options are there. Earlier, like if I say 10 years back, we were having very limited PhD options, but nowadays we have many universities which are offering PhD in India also. So you can find out there are ample of opportunities in PhD, and abroad also there are many universities which are giving. So when you think of going for a PhD, or then you have to see which area you want to specialize, in which area of research you want to do. Find out the university website, what is the work going on in those universities. Don't blindly go and take admission for the PhD, because you have to work. When you go in a PhD, it is a long-term research work, and if the area is of not of your interest, you will lose interest and you will come in between. So, and that is going to be losing 2-3 years of the time and money and everything. So when you think of going for a PhD, just don't run behind the name of doctor only, because we have seen that many people are just running behind the title of doctor, so they are running behind PhD. But when they enter in the PhD, they see okay, this is a very big task to be completed. So when you start your PhD, it's a whole new journey altogether in research. So, and there are lots of opportunities in India also. You can see there are many universities. The admission offers are coming up. Admission notices are coming up during. So in PhD, you have admissions every 6 months. Generally, universities take entrance in December and June. And so when you are interested, you can just go to the websites of various universities and apply for entrance. And once you clear the entrance, you get an admission in PhD. But talk to the guide, whoever is available in that university, before starting a PhD. Because if guide's interest is something else and your interest is something else, then your PhD may be a disaster at the end. Sometimes it may happen, because guide don't know much about your area of interest and you don't know about the area of guide. So ideally, you should be working with the guide who is having a area of interest which is the same as your area of interest.
So next question is like, what are the most promising career paths for the optometrists in the 5 to 10 years?
See, career paths are at present also, and in future also, there is lots of opportunity which is going to get it there now also, and newer as the new councils are coming up, and most of the state councils are already there. And most of the national commission, that career path and job opportunities are going to be increasing in the field now. Like you will see lots of in colleges and universities also, job opportunities will increase. Industry also, there will be lots of job opportunities are going to increase. So the people who are taking admission this year, or even now the optometrists which are going to pass out, they will have ample of opportunities which was not there 10 years or 5 years back. So whoever is entering in this profession now, they are the most luckiest people, you can say. because now profession is getting recognition. Profession is now regulated also. So you will have lots of opportunities. Even in the government sector also, you will see lots of opportunities are coming up. Even private sector also, there will be many opportunities which are coming up. And you yourself can create opportunities by starting your own clinics.
Okay, sir. So now we have some live question. Like first question is, I am the first year optometry student. I just want to know, can I optometrist prescribe eye drop, and is there any limitation?
For the first year student, definitely you cannot. But once you are getting complete a 4-year or bachelor's of program, so depending upon the country to country where you practicing, so ISCO says optometrists can prescribe basic eye drops. And so in certain countries, optometrists are even, like in US, certain states, optometrists are allowed to perform even LASIK or refractive surgeries also. But it also varies from country to country. In India, at national level, the scope of practice document is yet to come. But state like Tripura has given the scope of practice. There they have allowed optometrists to prescribe medications, eye drops. So it is, let's wait for some time. But basic things, basic treatment like spectacles, contact lenses, major work of an optometrist is to treat ocular conditions by using spectacles, contact lenses, or therapies. That is the major job of an optometrist.
Okay, so next question is, can we do B-optometry after diploma?
Yes, you can. After, but diploma should be after 12th science, and you can go for a lateral entry in that Bachelor of Optometry. Lateral entry, you will get admission in the second year of Bachelor of Optometry after once you have done a diploma in optometry. So that option is there. Most of the universities are still giving lateral entry admissions.
And the last question is, I started a job after completing my diploma. Can I do an internship?
Internship? Which internship? See, if someone has done diploma in optometry, he is eligible to take admission in second year of Bachelor of Optometry. And then in Bachelor of Optometry, once he is doing whole program, then internship is a part of that program. Separately, there is no use of any internship without a qualification.
Okay, so thank you, sir, for your insight response.
And one more thing I would like to tell to every student: don't get under trap of many people or many institutions or many coaching centers. They are just making people that you have done a diploma, you keep working, and we will give you a degree of from some university which you have never seen, and a distant learning or something else. So make sure the university is valid where you are doing your bachelor's program, and it should be a full-time program only. Do not get in trap of such people who just give you certificate without attending any classes. So those programs will not be recognized by the council, and you will end up having like diploma, but you cannot practice. So registration document, you will require the proper qualifications.
So any more questions from the attendees? If anyone have any questions, can type on the chat box. I hope everyone is cleared, because sir have explained everything in very brief and everything in so detail that I don't think so we are left with any more questions. But if anyone is having any questions, can type in the chat box. Harsh, you have raised your hand. Do you have something to ask? Okay, Ekta is saying, sir, thank you so much. It's really nice presentation. Everyone is just mesmerized with the session. Thank you so much. So on the behalf of Indian Optometry Federation, as well as from Himachal Optometry Association, we like to thank you. We would like to extend our heartful gratitude to our keynote speaker, Dr. Gaurav Kumar Bhardwaj, for sharing his valuable insights and expertise with us today. Your session was truly enlightening and inspiring, and it added immense value to all of us, even us, and to every student professional. It was such a wonderful session. Thank you for taking the time to be with us and for contributing to the advancement of knowledge and professional growth within the optometry community. We would like to have such more sessions in future, sir. Thank you so much.
Thank you very much for inviting me as a for the lecture. And I hope the people, some thoughts will be clear for the student who are just passing out and what to do in the future. So that was the main purpose of the session. So thank you very much for attending. This is for the attendees. I hope they will be getting benefited and some doubts will be cleared. So if they want to ask anything else, they can just write to us and then we can answer that thing also.
Sure.
Fine. Thank you very much.
Thank you so much.
So audience, I'm sharing the feedback form link in the chat box. I kindly request all the participants to fill out the form, and
Yes.
please note that the e-certificate will be provided after submitting the feedback form.
All attendees must go to the chat box, and even we will be sharing it on the mail. Kindly give your immense feedback and take some time to fill the feedback. Then only we all will be providing you the certificate.